are your child sneezing non-stop every morning? It might not be just a cold. It could be allergic rhinitis. Most common symptoms of allergic rhinitis are sneezing continuously, stuffy or running nose, itching in the nose or watery eyes, and dark circle around the eyes. Common indoor allergens are dust mites, molds due to dampness, incense sticks or agarbattis, perfumes or any kind of aerosols at home, furs from cat or dog, cockroach droppings, and soft fur toys. Outdoor allergens like pollen grains, smoke from vehicles, and crackers. Diagnosis mainly depends on history and nasal examination. Common test to diagnose this allergic rhinitis is blood IgE levels, AEC count or absolute eosinophil count, and skin prick test. Treatment mainly includes avoiding allergens, antihistamines, and decongestants, intranasal corticosteroids in the form of inhalers or spray, pranayama and breathing exercises, nasal irrigation with saline solution can help clear mucus from nasal passage. For more severe cases, consult your immunologist for newer treatment options like immunotherapy. Here are some steps you can do to reduce your allergens. Regular use of mask while going outside. Avoiding going out during peak pollen hours. Vacuum your curtains, carpets, and mattresses. Sun dry your bedsheets and pillow covers at least once in a week. Avoid woolen blankets. While cleaning or dusting, use mask. While gardening, tie a cloth or mask as there is molds or pollens in the plants. Avoid pets or use mask while handling pets. Fix any damp walls or leaking pipes. Use air purifier. Avoiding allergens is always better than the treatment. Share this video with someone who is having early morning continuous sneezing. Subscribe for more such health related videos. Thank you.